Medical Center, and welcome back, Michelle. She's presented in the past, and take it away. Tell us a little bit about Facebook.
All right. So we've been doing our Facebook patient support group since March of 2011. Our regular Facebook page has been very successful, and feedback. There we go. Used to that. Is this taking away from my 5 minutes? Am I being subtracted here? Anyway, if I stand properly. It's okay.
It's not you, it's the booth.
It's not me, it's something else.
It's not you, it's me.
That's a good line. So the reason we got these groups started is that our patients requested it, some of the departments requested it because, for example, our transplant department, they have an in-person group, but on the average they got about 30 people each. And with these groups, there's potential for a lot more participation, a lot more members. So it is an outgrowth of the traditional in-person groups. We have them managed by a nurse practitioner in each department, but we co-manage it in communications, so I'm an admin also to these groups. So it's a mix of closed groups and secret groups. There are 3 privacy options with Facebook. So far we haven't done an open group yet. So these are the groups we have. Liver transplant is the most popular with, as of today, 85 members, and the numbers keep growing. Very active on that group. We have trauma survivors, Hep C, IBD, and we're probably going to be starting more transplant groups and a children's heart program group, bariatrics, so the possibilities are almost endless. So why the groups were started, I sort of touched on that in the beginning. Departments requested it, patients asked for it, and we wanted to expand the reach of our patient support services. So far what we've seen is the activity level varies by group. As I said, liver transplant's the most popular so far. And to me, it's just remarkable how engaged everyone is. They support each other, they encourage each other, they ask each other questions. The group admins can weigh in with any relevant health questions and can answer anything that people may post in the group. And they even plan events. Recently, the Liver Transplant Group had an event, a luncheon, with a speaker from the Living Legacy Foundation, and I think over 60 people came, so that was a really successful event. So this is just a screenshot of thanking everybody who participated in the event. Advantage is it's convenient for people. They don't have to travel to get to a group. They can have access 24/7. We can reach more people potentially. The groups are easy to create and manage overall, and it just offers them a chance to support and interact with each other anytime they want. You know, there's just more potential for that kind of support. And just an example of some support. Somebody's asking, have you had this procedure? And then other people said, yes, I've had this procedure, and they can give advice. And then it could just be to encourage each other. You know, this is the second year I've had my transplant, where it's like just supporting each other, giving them pats on the back. It's great how they do it. I mean, they're very, very active. So the administrators, we want a clinical administrator, somebody who's like a nurse practitioner, that kind of thing. So we ask them to monitor on a daily basis, respond to questions and concerns, because often people do have health questions, but they don't give specific advice to their condition. It's just general information, and then if need be, they direct them to take it offline. And then we see it as 2 more minutes. We oversee it, so I would oversee it as a second administrator. Just an example of an administrator providing advice. She's talking about the cold and flu season, how it's important to get the flu vaccines. She's the administrator for our liver transplant group, and she does a great job with providing information. And just the last slide here, one of the administrators giving feedback on the advantages of the group, talking about the convenience of it, and especially for something like IBD, how people are more comfortable maybe online than they would be talking in person about something like GI issues and the potential for this medium. Thank you.